Welcome to Let's Talk Micro.
Hello, my dear audience. Welcome to another episode of Let's Talk Micro. As always, I hope you had a great week. And of course, you can always find Let's Talk Micro on Apple Podcasts, Spotify, Amazon Music, Goodpods. Wherever you listen to podcasts, you can find Let's Talk Micro. As far as social media, I am on Instagram, TikTok, and YouTube as Let's Talk Micro, on X as Let's Talk Micro 1, on Blue Sky Social as Let's Talk Micro, on LinkedIn as Luis Plaza, and I have an email address which is letstalkmicro@outlook.com. So either via social media or via email, you can reach out with any suggestions, any feedback. They are always welcome and appreciated. So please go ahead and subscribe to the podcast, download episodes, and if the app allows you to do so, please go ahead and leave a review. Thank you so much for the support. And as you know, the Let's Talk Micro podcast does not have any sponsors. So if you want to support the podcast in any way, you can do so via Venmo or via Buy Me a Coffee, KOFI, both links available on the show notes. And of course, if you are looking to learn more about antibiotics, please check out www.learnantibiotics.com and the Learn Antibiotics book available on Amazon. These resources include cheat sheets, practice tests, games, and more, and they are being used by thousands of people worldwide and may be helpful for you or your colleagues. So definitely check out these great resources from Dr. Timothy Gauthier, a very passionate pharmacist. If you haven't checked out the previous episode, please go ahead and do so. It was a great episode and was actually the next episode on the AMR series with Andrea Princey. And of course, for the benefit of those that are just tuning in, so if this is your first time listening to the podcast, first of all, welcome. And I'm just going to take a quick moment to tell you about the AMR series. So within the podcast, we created a series which is about antimicrobial resistance, and we basically started from the beginning. So we just started breaking down antimicrobials. So we go over things like mechanism of action, intrinsic resistance, which organisms does the drug has activity against. Definitely, we try to explain things as simple as we can. And in that series, typically I do the podcast alone. But for that series, I do have a co-host, which is Andrea Princey. She's a fellow microbiologist. And we just, bring a guest and we go over the different classes of antimicrobials. Because by now we have gone pretty much over most of the classes. We started with beta-lactams and we have done tetracyclines, aminoglycosides, fluoroquinolones. So if you haven't checked out any of the episodes, I definitely invite you to go ahead and do so. Check them out, download them, and listen to them. They have some great guests, great topics, great conversations, and this last one was not an exception. So in the last episode, we went over the class, the oxazolidinones. Definitely a mouthful, right? So this was very fun because the episode started, and as we started, Andrea was talking about how to pronounce the group, and then our guest, David Allen, asked her to go ahead and pronounce it. And she went ahead and did it, and it was great. She pronounced it correctly, so it was fun. And you might not be familiar with this name, with this class of antibiotics, but definitely if you perform testing in the lab, you know the name of one antibiotic in this group. And maybe by now, those of you that are seasoned microbiologists, you might know the antibiotic, and if you don't, that's okay. That's what we're here for, right? To talk about things and learn together. So one antibiotic in this group is linezolid. And if you work in the lab, definitely if you perform testing, right? If you do susceptibility testing, I'm sure you have done testing for Enterococcus. And one of the antibiotics that gets tested is linezolid. It is definitely part of some Vita cards used for susceptibility testing for gram-positive organisms. So definitely, all in all, it was a great episode. So check it out if you haven't already. And before I move on to today's episode, just circling back to the AMR series, after we go over the classes of antibiotics, then we're planning on going over mechanisms and diving into that, which I know it's definitely very complicated, but we'll try our best. Okay, so let's go ahead and talk about today's episode. There is no guest, so it is me talking about an organism. So as always, if you enjoyed this type of episode, it is for you. And if you prefer the episodes with guests, definitely I please ask you to go ahead and stay and listen to this one. It has some great content, so definitely I'm looking forward to talking about this with you. Okay, so those of you who listen regularly know that I have had by now Dr. Kelli Maddock in the podcast twice. and she is the section head of microbiology at the North Dakota State University Veterinary Diagnostic Laboratory. And the first episode that we did, it was with her and Sarah Geffro, and it was about veterinary microbiology. And maybe you might not be aware of this, but as an MLS, you can work in a veterinary lab and do lab testing. So in the episode, they talked about testing in the lab. We talked about organisms, and it was definitely a very fun episode. And it was recorded last year, but recently I re-released it, so you should see it at the top of your list. So if you haven't checked that one out, definitely please go ahead and do so. And then the second episode that Kelly did was about Pasteurella multocida and capsular types, and that one was actually published 2 weeks ago. So definitely check it out if you haven't already. And in the episode, she mentions different animals where different capsule types are seen. She talks about hemorrhagic septicemia and a model they developed to look for capsular types using moldy tough MS. And you know that Pasteurella is my favorite organism, and in 2021 I recorded an episode where I talked about why is it my favorite. So you see where I'm going with this. By now we're combining that, Kelly came in, she talked about Pasteurella and capsular types. And you combine that with the fact that I did do an episode in 2021, but it was brief, and I just briefly went over different species and talked about biochemicals. So I thought this was a good time to go over Pasteurella. And instead of a brief overview, we're gonna do a deeper dive. So I'm gonna give it a shot, but just letting you know, Kelly did a great job talking about the capsular types. So I'm just gonna leave that for that episode. So let's go ahead and give it a shot. Well, Pasteurella is part of the family Pasteurillaceae, and this family has over 25 genera. Other examples of this genera are Haemophilus, Actinobacillus, and Aggregatibacter. And as you know, taxonomy is something that might cause stress in the microbiology community. There's always so many changes we have to keep up, and I mentioned this before when we do moldy tough now. Moldy tough MS, and now we're seeing all these names and we have all these changes. So sometimes, it might be a little stressful keeping up, and you get all these reclassifications and things like that. So it is not fun. But, it's something that happens as more and more molecular testing is done and things like, gene sequencing. And then you discover that one organism is more similar to another one or is different enough from another one to be its own, genus. So it happens, and we might not like it, but that's just the way it is. And having said that, this family is no stranger to that, and many renaming and reclassifications are taking place. But, let's go ahead and stick to Pasteurella and save that topic for another day. Okay, so if you're listening, you're a microbiologist, or, you're going through a medical lab sciences program, maybe you went already, and you're definitely familiar with some species of Pasteurella, right? So which ones are you familiar with? And I think that you're definitely thinking about Pasteurella multocida and Pasteurella canis, and I'm sure that those are the ones. They're the ones most commonly seen in the lab. So I'm sure that those pop in your mind. Well, other species include Pasteurella aerogenes, Bettiae, Dagmatis, Cavalli, and Oralis. Pasteurella multocida has some subspecies, which are Pasteurella multocida, subspecies multocida, Pasteurella multocida, subspecies septica, and Pasteurella multocida, subspecies gallosida. And if you're a microbiologist, you know that there are some organisms that are part of our normal flora, right? And we know, depending on different areas, right, that we have Eikenella in our respiratory flora, we have, Enterobacterialis in our enteric flora. And when it comes to humans, Pasteurella is not part of our flora. However, I found something interesting in Bailey and Scott's Diagnostic Microbiology, which is a big resource that I use for the podcast. And that interesting note that I found is that Pasteurella might be found in the upper respiratory flora of humans that have long-term exposure to animals, such as farmers. And of course, that's something that makes complete sense, right? Because as you know, if you're exposed to animals, you're constantly working with them, and you're handling animals, and there are some common surfaces. So it will make sense that you will get some of those organisms in your flora. But as you know, Pasteurella is part of some animals' microbiota, some part of the flora. So it is seen in a variety of healthy and diseased animals. Out of the species mentioned, Pasteurella multocida, canis, stomatis, oralis, aerogenes, and dagmatis are isolated from humans. And since these organisms, are seen in a variety of animals, it will make sense that when we see them in humans, one common mode of transmission will be bites, right? So when the samples that you're commonly seeing in the lab, there are product of bites, so you get those wound cultures that are, from tissue infections. So whether you are in a big lab and compartmentalized and you have like a separate wound bench, or you have a smaller lab, you will typically see these organisms and cultures that the source is a wound. So let's go ahead and spend a few moments talking about which animals. So Pasteurella multocida is found at higher levels in cats and dogs. Pasteurella canis is found in dogs. Pasteurella aerogenes is found in pigs. And I shared this before, but if you're listening, I'm gonna share it again. And when I talk about media, I'll talk more about Pasteurella aerogenes. But it was definitely, I remember the first time that I had it, and it was very amazing for me because I learned so much. Because I mentioned this before, but sometimes when you're going through like a medical lab science program and maybe you touch on some of the organisms, but one of the things that you learn about Pasteurella, and I'll go over this when I talk about media, but that is that most species, they do not grow in McConkey. So but Pasteurella aerogenes does, and I didn't know that. And when I saw an ID of Pasteurella, I was skeptical, but then I did the research and I found out that yes, Pasteurella aerogenes can grow in McConkey. Anyway, it was an amazing nerd moment, so I really loved it. Well, let's go back to talking about Pasteurella animals. So Pasteurella cabalis is found in pigs and equines. Pasteurella dagmatis and stomatis are primarily found in dogs and cats. And something interesting when it comes to Pasteurella bettiae, it's that it tends to be recovered from genitourinary samples, and this suggests a possible sexual transmission. And as I was doing the research for this episode, I read that there is uncertainty regarding the habitat of P. bettiae. And as I mentioned, the primary mode of transmission of Pasteurella to humans is by contact, and bites are the most common. And another example is by the animal licking a wound. So let's go ahead and talk about pathogenesis. And since the primary mode of transmission is bites, a common infection associated with Pasteurella, most species, is soft tissue infections. But there is definitely more than that. Pasteurella multocida is associated with other infections at a lower level of wounds, of tissue infections. So meaning that there are lower occurrences. So, and the examples of these are respiratory infection, meningitis, osteomyelitis, endocarditis, and dialysis-based peritonitis, among others. And there is a risk factor for systemic disease, which is liver cirrhosis. So, out of the different subspecies of Pasteurella multocida, the subspecies Pasteurella multocida is the most frequently isolated and is associated with respiratory infections and bacteremia. And then Pasteurella multocida subspecies septica is associated with wound infections and central nervous system infections. Pasteurella dagmatis has been reported in some systemic infections such as pneumonia, septicemia, and endocarditis. Pasteurella bettiae is associated with genital tract infections and has been seen in neonatal infections. When it comes to virulence factors, for the most species they are unknown, but there are definitely some in Pasteurella multocida, and they are endotoxins, cytotoxins, and capsules. And this is the part where I refer you to Kelli's episode, which was episode 166, because she does a beautiful job of talking about the capsules. And, so I'm not going to do it justice. So definitely check that episode to learn more about that. And Kelli is a veterinary microbiologist. So that episode, when it's about Pasteurella, definitely focuses on animals. And here, I'm talking more about humans. But definitely a great job talking about the capsules. So check out that episode. And just one more thing about that episode, when she talks about the capsules, she talks about hemorrhagic septicemia associated with capsules, and she talks about that. So definitely a great episode. So check it out if you haven't already. Okay, so now that we have talked about pathogenesis, let's talk about lab stuff, right? So we are microbiologists. If you work on the bench, you want to know things like, right, media, morphology, biochemicals, antimicrobials. So let's start with the basics. Let's go ahead and start with the gram stain. They are short gram-negative rods, some being coccobacillary, and the textbooks make mention of Pasteurella aerogenes being very coccobacillary. And for Pasteurella bettiae, the rods might be thinner than others. And when it comes to forms that are coccobacillary, and this is something that I have talked to my students about and I have talked to techs about, right? Because I know that especially when you're learning, coccobacilli can be confusing. And right, you're looking at them and it's, is it a cocci? Is it a rod? They're so tiny. So as you learn and you do gram stains, definitely I really encourage gram stain as much as you can. It really helps you. And remember that if you find yourself looking at a gram stain, you have something that's gram negative. And as you're looking at it, it's very tiny and you can't really tell, you can't tell if it's a rod or if a cocci. You're looking at it and I'm like, I just can't tell. The probabilities are that you either have a Haemophilus or you have a Pasteurella. So remember that. And if you're looking at a gram stain, if you see if you see rods, so you see these tiny things, you don't know if they're cocci or rods. But as you are looking at it and you scan your slide, you see some that you can clearly tell that they are rod shaped, then you have gram-negative rods. And I tell you this because I just want to make sure that you don't mistakenly report something as a gram-negative cocci. When you think about gram-negative cocci, you think about kidney beans, right? And they are larger than your gram-negative coccobacilli. So if you're in the lab, if you're a student, I want to challenge you to perform multiple gram stains. So go ahead and grab an Acinetobacter, grab like an Neisseria gonorrhea, grab a Moraxella, and then grab a Haemophilus and a Pasteurella and do a comparison. And you're going to see that while, for example, Acinetobacter, you get this plump coccobacillary rods, but they're definitely larger. And then gram-negative cocci, they're smaller than that. And your coccobacilli are smaller than both of them. So anyway, just keep that in mind. And when you find yourself having a hard time, I can't tell what's happening. I don't know if it's a gram-negative cocci or a rod. You probably have a Pasteurella or a Haemophilus. Okay, so now that we know about the gram stain, Pasteurella, they are non-motile and they are glucose fermenters. And as far as media, they grow in blood and chocolate agar. And I mentioned this when I talked about Pasteurella aerogenes, but most of them do not grow McConkey. And the exceptions are Pasteurella aerogenes and some strains of Pasteurella bettiae. And in the textbooks, there's mention that they might look like lactose fermenters on McConkey, but I'm not too sure about that. I mean, the colonies are small, and then to me they look like they may be like a dull pink kind of. But I wouldn't call them, lactose fermenters. Or better said, not call them, but think that they are. I wouldn't think that. So before we continue going, just let me touch real quick on my story. So as I mentioned, I went through the program and the medical lab sciences program, and you learn about the organisms, but sometimes you're moving fast paced. And when I went through, we had one semester of parasitology and then one semester where we had bacteriology, mycology. So there was a lot of material for one semester. So you kind of maybe you stuck to learning about the classics, and I definitely knew that Pasteurella, grew in blood, grew in chocolate, but did not grow in mac. And one day I'm working on the bench, and then I see an organism that's growing on blood, chocolate, and McConkey, and I see that a Vitek ID was done, and the ID was Pasteurella aerogenes. And I kind of, I was dubious, and I wasn't sure what to think of that. But before I talked to my supervisor, I'm like, let me go ahead and do a little bit of research. So I pulled my books. I remember looking at the Manual of Clinical Microbiology from the American Society for Microbiology, and don't quote me on this. I think it was the 9th edition. I remember the books were like a dark green. And there it said that out of the Pasteurella species, Pasteurella aerogenes grows on McConkey, and it is seen in pig bites. So that led me to check the patient's history, and there it was. The patient actually sustained a pig bite, which is kind of odd in Orlando, right? But But it might not be a great story, but I remember that day and I enjoyed it so much that it was just, I learned, and that's something about this field that I love, that, you get to learn new things, and the field changes, and the organisms, they don't read textbooks, right? Like we say. So we find some abnormal things, some, weird morphologies, weird things growing, and I don't know. It's fascinating. And I always like to make the disclaimer that yes, it is fascinating from the learning point of view, but of course, these organisms, they mean that the patient might be going through some sort of infectious process, and that's not good, right? So I just want to keep that clear. When it comes to morphology, the colonies, they have like a grayish color. They are non-hemolytic. They're smaller than other colonies, as compared to, let's say, the Enterobacteriales. And while you should never smell plates, right? But sometimes, you get some smells coming, and I think Pasteurella has like some sort of musty odor. It's definitely very peculiar, so you have it when those notes hit you. As far as biochemicals, they are oxidase positive, but keep in mind that sometimes, you get some weaker reactions, so it's not that beautiful oxidase that, let's say, you have with like a Neisseria, or you have with like a non-fermenting gram-negative rod, like Pseudomonas aeruginosa, for example. So a lot of times, and those of you that work in the lab, sometimes, we do oxidase testing on filter paper, right? So we flood the paper with the reagent, and then we use a stick, we grab the colony, and then we touch. But when it comes to Pasteurella, I think it works best when you do the swab. And even then, sometimes you don't even see a reaction, or if you do, it's very weak. So keep that in mind when you're doing testing. When it comes to indole, most species are indole positive. However, Pasteurella aerogenes and Cabalis are indole negative. And these two biochemicals are the most commonly performed on these organisms, but however, most of the species are catalase positive. Pasteurella bettiae and Cavalli are catalase negative, and all species reduce nitrate to nitrite. Okay, so now that you know about morphology and biochemicals and gram stain, I'm sure you want to know about susceptibility, so I'm just going to briefly touch on it. And as I do, I want to point you towards the CLSI documents, in the AMR series, and outside of that also, I always point to the text to make sure that you get familiar with your CLSI. And I always talk about the CLSI M100, and that's where you actually find most of your organisms, your very commonly encountered organisms in the lab, like staph, Enterococcus, strep, Enterobacteriales, non-fermenting gram-negative rods. And when it comes to Pasteurella, you can find information about it on the CLSI M45. Both resources, you can find them online for free. And besides Pasteurella, you find other organisms there, like, you can find the CLSI M45, you find information about like Eikenella, Lactobacillus, Micrococcus. So definitely, I want to give you homework and go ahead and get familiar with those documents. And you can, as I said, you can find them for free, and it is as easy as going on a search engine and typing free CLSI M100, and that takes you to a website where you have to enter an email, and there you can find both CLSI M100 and CLSI M45. And when it comes to Pasteurella, the CLSI M45, and it does this not only for Pasteurella but for other organisms, so you get information about what type of media to use, the incubation temperatures. So when it comes to Pasteurella, you can use Muir Hinton blood, and then you incubate it in a non-CO2 incubator. And the CLSI M45, it gives you breakpoints for this diffusion, and it also gives you MICs, which is minimum inhibitory concentration. And something interesting about Pasteurella, it's its susceptibility to penicillin. And why is this interesting? Is because, penicillin does not have activity against most of the commonly encountered gram-negatives in clinical settings, because they are intrinsically resistant to it. So that's something, that's something interesting to learn about. And Pasteurella species are typically susceptible to most agents used to treat bacterial infections. There is some resistance to erythromycin. And I want to share something interesting from the Manual of Clinical Microbiology. And it says that susceptibilities may be warranted when isolates are obtained from normally sterile sites, and a beta-lactamase test should be performed, including on isolates from respiratory infections. And the manual also says that susceptibility testing is not necessary for isolates from wound infections, since they are empirically treated with agents used for this type of infections. So I am definitely curious to know whether you perform susceptibilities on all Pasteurella, or maybe you don't do any because your lab doesn't have the capabilities, but I would like to know. So maybe reach out via email or via social media and let me know if your lab only performs susceptibility on Pasteurella from like sterile sites, or maybe if you do them across the board. Let me know. I'm really curious. Okay, so let's go ahead and do a quick recap. Today we went over different species of Pasteurella, which they are found in many animals, including cats, dogs, pigs. And I went over different species. And in the lab, definitely very common is to see Pasteurella multocida, Pasteurella canis, and others that I mentioned. And Pasteurella is not part of our flora as far as humans, but it might be found as part of the flora on people that are exposed to animals long term, and a great example was farmers. And since these organisms are typically found in animals, a common mode of transmission to humans, it's contact such as bites. And the primary infection is, soft tissue infections, which is why you typically see Pasteurella like in the wound bench, let's say. As far as gram stain, they are short gram-negative rods, some of them being cocobacillary. They grow in blood and chocolate. Pasteurella aborigines and Bettii grow in McConkey, the others do not. All species are oxidase positive, and mostly indole positive as well, with some exceptions. And when it comes to virulence factors, as I mentioned, they are unknown for most species, but however, for Pasteurella multocida, you have things like capsules, which Dr. Maddock does a great job. So once again, I want to point you to check out that episode so you can, complement this episode with that one. And I just want to make sure as I wrap the episode for the text, definitely as we get things like Molotov, and maybe you don't have Molotov, but sometimes, people don't want to do gram stains. And most of these species, they do not grow MAC. So remember that, and don't assume that, because that's one of the biggest mistakes you can make as a tech, is assuming that it is gram positive because it is not growing on MAC. So definitely, as always, look at the patient's history, perform biochemicals, and as you're learning, definitely continue making use of the gram stain. Even if you're experienced, it is a great tool, and I cannot stress that enough. It's going to help you out, but most important, it's going to prevent you from making a mistake. And as you know, in our job, our mistakes, can affect the lives of patients, which is what we do this for, right? So always make sure you do the best job you can. And that is achieved by education and repetition, getting familiar with your resources. That way, when you sit on that bench, you do your best. And that's what we want. And that, my dear audience, it's the end of this episode. I hope you enjoyed this deeper dive on Pasteurella. As always, I enjoy sharing this information with you, and I definitely enjoy talking about Pasteurella. It is my favorite organism. So I hope this benefits you somehow, and check out the other episode, because it is such a fascinating organism. So stay tuned, great things coming your way. And definitely, as you are listening to this, maybe if you're listening on Friday, December 13th, the episode is going to publish on Thursday, December 12th. But on Friday, I am graduating and receiving my master's degree. I finished. I did it. Thank you so much for your support, for your understanding, which sometimes I couldn't post any episodes. But I reached the finish line, and it feels great. Thank you so much. So please, continue bringing that passion to what you do. It is so important. You do such great work. So, as always, stay motivated, stay safe, and of course, continue talking micro. Until the next time. Bye.